Can you see, Ruby?
We haven't got the slides just yet. Oh, I think it's happening now. There we go. Brilliant. All right, fantastic. Can everyone hear me okay?
Yes.
Got a fan in the background. All right, brilliant. So welcome everyone. Just want to say thank you, first of all, for giving up a little bit of your evening tonight. Over the next half an hour, we're going to try and really cram in an introduction to public health. Just written down here a few key people. Rob, if you want to kind of give a little wave, Rob Percy, our Exec Director for Adults and Health. Councillor Willoughby's here as well, our portfolio holder. Myself, I'm Ruby Baines, I'm the Director of Public Health. Harpal and Beth are also here, will be leading the presentation with me, who are consultant and acting consultant. And we've had support from our Anisar Finance business partner as well on the slide pack. So should we go to the next slide? Perfect. So I guess the first question is, what is public health? Public health is known as the science and art of basically preventing disease, prolonging life, and promoting health. And the key bit is through organised efforts of society. That's because the public health team don't work alone. We work with a lot of partners, a lot of system partners, and our colleagues across the council to try and improve health and wellbeing of Thurrock residents. I've got this slide to start with, which is the building blocks of health. And this is really important because only 20% of our health outcomes, 20 to 25%, are due to health service provision. A lot of our health is due to all of these other factors, and some of this I think is common sense, but the food we eat, the environment in which we live, the quality of our housing, whether we have good employment or not, our social connections with our friends and family, access to good transport and education. So these factors are really important, and I just wanted to kind of start off with that point. If we move to the next slide, Beth, thanks. So how do we organise ourselves as a team? So here, I won't go into it with a lot of detail, but these are the areas how we work. So we have a health improvement team. We focus on healthcare, public health. Some of this is around NHS health checks, working with our local GPs and our NHS partners. Health protection, we all remember COVID-19, so infectious diseases, emerging risks, and the wider determinants of health, which relates to the first slide I showed you, which is all those other factors that contribute to health. And we work with our partners and council colleagues to improve those. And importantly, we have a health intelligence function, and we also work with Essex County Council and Southend-on-Sea on a research collaboration across Greater Essex as well. So there are a lot of public health outcomes that we're aiming to improve, and I've only taken a small snapshot, but these ones are quite important ones, and some of these relate to those that we have in our council corporate plan, and you'll see also feed into our health and wellbeing board strategy. So Thurrock has a high proportion of children and adults who are not as active as they should be. And this consequently contributes to a higher proportion of children and adults being overweight or obese. The importance of that is because it then puts you at a higher risk factor for having long-term conditions and impacts demand on health and social care services, and importantly, your quality of life and life expectancy. So I've put these figures here because as you can see with some of these indicators, we are significantly worse than England. So there's a lot in this space to unpack, but I wanted to make sure that you're aware these are some of our key priorities, and importantly, also trying to reduce the proportion of people who smoke that has a clear impact on health and health outcomes. Also highlighting here the proportion of people that living with some form of mental health or long-term health condition as well. We've also put an indicator on working age here, because it's important, as we talked about the wider determinants of health, getting people in good employment as well. So on this slide, we have two maps, and the purpose of this slide is to demonstrate the concept of health inequalities. So when we take one of these factors or one of these indicators, it is just a high-level average for Thurrock. What's underneath this is variation across Thurrock. So some areas do better, and some areas have got higher challenges. The map on the left is a standard map of indices of multiple deprivation. So what that really means is areas where there's a higher proportion of socioeconomic challenge. And that's the most simplest way to put it. But importantly, when you look at the map on the right, that looks at the proportion of Year 6 primary school children who are overweight and obese. What you can see is that there is a correlation there between areas where there's higher levels of challenge and areas where there's higher or poorer health outcomes. And that's not just for this indicator. There is a theme there where areas where there are higher challenges, there are often poorer health outcomes. And that's also important for us to consider how we deliver our services. So what you'll hear a lot from our directorate and also children's is the importance of prevention. And this is a kind of metaphor here about somebody crossing a bridge, somebody's fallen into the bridge, and somebody who's on the left here, really further down the river, and there's some danger there. So what we are trying to do in public health is really focus our efforts upstream, so more towards the right. Some of the interventions we do, some of our services, stop smoking, being a healthy weight, staying fit and active, it's really more towards the right, which is trying to make sure people who are well stay well, and for people who already have long-term conditions that they stay as well as they can to prevent further complications. So that's the kind of high-level introduction to public health, and my colleagues will in a minute take you through some of those areas in a lot more detail. I wanted at this stage just to highlight some bits regarding the finances. So local authorities receive a grant called the Public Health Grant, and Thurrock's allocation is approximately 14 million for this financial year. The key important points to note are that it's a ring-fenced grant, which means it's got particular terms and conditions which are set out nationally about how this grant must be used. And that is all, as I've mentioned, set nationally, and we need to comply with those. The vast majority of the grant is there to deliver the statutory responsibilities and public health services and programmes that are designed to improve public health outcomes in Thurrock. So a lot of that, as I've mentioned, relates to statutory services, but statutory public health services. So the grant cannot be used to fund other council statutory services, and that's an important point as well. the reporting of how the public health grant is used is both to internally to Thurrock Council, but also to the Department of Health and Social Care, in particular the OHID department. And both myself as the Director of Public Health and Section 151, which is finance head of finance for local authorities, have to review this, and we give a statement of assurance which is submitted to the Department of Health and Social Care to make sure that we are complying with the terms and conditions as they've been nationally set. I think we can go to the next slide, Beth, thanks. And again, this is very, very high level, and there's lots more information. But on the left here are some of the large statutory services that we deliver. And what I find often interesting is quite often when you're talking to residents, they may not know that these services are actually delivered by their local council. So, for example, the 0 to 19 Children's Service. So this is health visitors, school nursing, and the National Child Measurement Programme, which operates through primary schools. NHS health checks, which you would receive from your local GP, which many of you may well have had. Sexual health services, so access to STI treatment and contraception, drug and alcohol, also treatment services, tobacco control, so our stop smoking and supervised toothbrushing is also a particular area of focus. We also receive some other ring fence grants, which to support particular activity. So the gambling levy, there's a lot of work on trying to tackle gambling. And also we have got a large programme of work with Sport England, who are working both at Essex level and also have focused on Thurrock because of some of those health outcomes I talked about earlier, to really try and increase our physical activity levels in Thurrock. I won't go into the other elements because my colleagues will tell you more about it, but the health and wellbeing strategy needs assessments, which are both the joint strategic needs assessment and pharmaceutical needs assessment. So again, I just want to highlight it's a very high level, and I'm going to now hand over to my colleagues Harpal and Beth that will take you through the next slides.
Thank you, Ruby. Hi everyone, my name is Harpal, and as Ruby mentioned, I'm one of the public health consultants in the team. I'm just going to do a few slides and hand over to Beth. I think we're doing a bit of a double act now. Yeah, as Ruby mentioned, the health and wellbeing strategy is probably the most underpinning strategy that we have in public health. Our current one is due to finish in 2026. So we have been working quite hard to develop a new one. Right now it's in the consultation phase, and I've put a link in the bottom there so you can have a look at it. It's got the main principles and priorities in that, so the public are allowed to comment on that now. The purpose of it is to really identify the local population needs and coordinate resources to reduce health inequalities through those delivered of shared priorities. And we've really looked at it, and there's kind of two overarching priorities that we've placed on it. So it's place and people. People, we've taken a life force approach, which is something that's done quite a lot now in newer health and wellbeing strategies. So that's looking at growing well, living well, aging well, and dying well, and working with partners to develop what the priorities are within that life course. As I mentioned, we're currently going through that consultation phase. In August, we'll be looking to analyse that feedback and refine some of those priorities. So within each of those life courses, there's some key priorities which is linked to data that Ruby showed you a snippet of in one of her previous slides. So all the priorities that we're highlighting are really pertinent to Thurrock and our local population. In September to January, it will go through to SLT and other governance structures, and then we're hoping to publish the strategy in January 2027. Alongside that, we'll be developing a delivery plan. So that will really kind of this is what we should be doing, and that should be the delivery plan will be how we achieve those outcomes. So that's a very active strategy that's being developed. So I'd really encourage people to click on that link and have a look at some of that in more detail. Next slide, please.
Very helpful. I think this is me. So I'm Beth Capper. I'm acting in the consultant in public health role. Ruby's mentioned the joint strategic needs assessment. I've emphasised joint there. This is a mandatory requirement for all councils, and we do it in partnership with our colleagues in the NHS, so the Integrated Care Board, hospital trusts, colleagues in primary care. It's governed by the Health and Wellbeing Board, and we've taken a new approach this year. So we've got breadth, producing some overarching products. I'll come on to the ward profiles in the next slide. Demographics, so looking at who lives in Thurrock, breaking that down by age, ethnicity, lots of information in that resource. The wider determinants of health we've touched on, so looking at housing, employment, transport, and the indices of multiple deprivation. This year we'll be doing two kind of deep dive needs assessments. We've started the first, which is on women's health, with a plan to look at men's health next year. And the second will be around education, skills and training, and we'll look to start that in the summer. And they're quite long, in-depth pieces of work done collaboratively across the system. And then we've got some higher level focus reports, situation reports, and you can see the list for this year there. Watch this space, the link again on the right, you can click through where our ward profiles are already published, and we're starting to finalise, and we're working with our graphics team to make them look snazzy, so they'll be coming up on our website soon. So that's the joint strategic needs assessment. And just digging into the ward profiles in a bit more detail. So for each of the Thurrock wards, we've got a slide deck with about 20 slides. I know you won't be able to read this, so it's just a kind of snapshot, and I do recommend you clicking through the link to have a look at your ward in more detail. The ward profiles are an overarching document with some of the key public health data for you to understand a bit more about your ward and population. So it covers demographics, as I mentioned, the population profile, ethnicity, life expectancy, deprivation. Then it details some of the long-term conditions, so coronary heart disease, diabetes, heart failure, hypertension, stroke, and then coming on to some of those wider determinants of health. So there's a slide on crime rates, employment, some of the lifestyle factors, so smoking and weight profiles for adults and children, and energy performance, which is linked, to fuel poverty and cost of living, which can impact on people's mental and physical health. So I do recommend that you look through your ward profile. Just to mention that there have been a few ward boundary changes with this latest election. This data is only available at the moment along the old ward boundaries, but as soon as we have data available at the new boundary level, we'll look to update those. So just to flag that. I'll hand back to Harpal.
Thank you, Beth. One of those blocks that Ruby mentioned at the beginning around what public health do, one of them is around health protection and emergency preparedness. So that really involves working quite closely with partners such as UKHSA, so that's a UK Health Security Agency, formerly known as Public Health England, and that's around emergency management and communications to respond to public health risks. So you might recall COVID-19. Local authorities had a big role to play in reducing outbreaks and really supporting vaccinations. Another kind of recent example is around the measles outbreak in Enfield and Kent meningitis. Again, we would support UKHSA with that response. We also play quite an active response in supporting increasing uptake as well. So, for example, for those measles uptake, we would review our data and see how much of our population has received both doses of their MMR vaccination. And in order to achieve herd immunity, you really want to aim for the 95%. And then we could look at some of that data and kind of really have targeted approaches. So that's one of the ways that we would support colleagues in the system of NHS England to increase vaccinations. We also prepare for emergencies, so adverse weather. So we play, as you know, we're in the midst of a heat wave at the moment. So we have an active role in really communicating with colleagues in the council and other organisations around messaging for heat waves. So we have an adverse weather plan, which is screenshot there, to support different organisations in the council and wider as well to deal with cold and hot weather. Another area is to coordinate rapid and local response to protect communities as well, in both kind of those adverse weather situations and also outbreaks as well. One that people don't always associate with health protection is environmental hazards and threats. So that does include things like fires, flooding, hazardous waste, and an example there is given the Tilbury dust. So that health protection plays a role in kind of protecting the community's health as well. And again, we've put a few screenshots of different vaccination posters around the MMR. I haven't put a link in the adverse weather plan there, but I can do that as well if people are interested. Next slide, please, Beth. I'm just going to go through the next two slides are just quickly going through some of the kind of bigger work streams, and Ruby has mentioned them in a previous slide. This just goes into a bit more detail, and I've also hyperlinked the titles as well. So if you can see a blue title there, that's a hyperlink to the service. So this would give you just a bit more information around what the service actually provides. So Ruby mentioned around the 0 to 19 program. So that's delivered with NELF, so North East London Foundation Trust, and that delivers a lot of the core kind of statutory responsibilities, as we mentioned: health visiting, school nursing, national childhood measurement program, the 2 to 2.5 year checks, and that kind of feeds into wider strategies such as the Best Start in Life. The sexual health service, so that's delivered by Brooke locally, and as Ruby mentioned, delivers those services there. We have our tobacco control and stop smoking services. So I have a slide later on explaining around some of the community outreach work that we do as well. The drug and alcohol treatment services. So that in Thurrock, we have Forward Trust for adults and Open Road for children and young people. And that, again, we have lots of outcomes that are measured with treatment for those services. But a lot more information if you want to know about it on that hyperlink. And one of the newer things that we've been looking at and developed a strategy around is the gambling harm strategy. And we work quite closely with Gambling Harm UK to integrate that more into our work streams. Next slide, please. And oral health improvement. So supervised toothbrushing, you might have heard earlier. That's one of the key things that we do with our early year setting. So it's a strong evidence base around if we can get young children to brush their teeth in school, it can really reduce pressures on the system. For example, not attending A&E and hospital for dental caries and dental tooth extractions. So strong evidence around that. Healthy weight and physical activity. So we have a healthy weight strategy as well, which cuts across all the public health domains and has a large role to play in that primary prevention, moving prevention upstream. Screening and immunization assurance. So we don't commission vaccinations and screening programs, but we play an active role in supporting and increasing uptake by working with the commissioners, which are NHS England. And the mental health and suicide prevention. So suicide prevention is something that is really linked to that mental well-being, something that we're working a bit more on now as well. And mental health, again, is that golden thread that links in through so much of our work streams. Next slide, please, Beth. And I think this is my last slide. So just wanted to also talk a little bit about our healthy lifestyle service. So within public health, we have a thorough healthy lifestyle service, which is our kind of community outreach. So Tina Lincoln and the team work really well to engage with the community, whether that's virtually or face to face, to offer some core public health services. So that's the stop smoking service and the healthy weight service as well, so reducing weight. Within that service, they also are able to use different forms of outreach as well. So making every contact count, we call it MEC. They're also able to talk about, reducing alcohol harm and linking with the community as well. And what we've done there is just given a link to the website and number that people can call to understand a bit more about those services.
So the integrated neighbourhood teamwork that we do is in partnership with, again, our colleagues in the NHS and across the council to think about how we can encourage prevention activity at ground level, working with communities and grassroots and identifying solutions at that level. And as Ruby's mentioned, we also commission our primary care colleagues to deliver health checks for those eligible. So it's a service offered for those between 40 and 74. So the last slide is our wider determinants of health work. There's a lot of activity in here. So just to highlight a couple of things, we work looking at our environments and how to make our Thurrock environment supportive for healthier choices. So thinking about healthy planning, placemaking, access to green spaces, walkable neighbourhoods included in that. We've talked about physical activity quite a lot, but through our partnership with Sport England, we have secured £1 million to support physical activity across the borough, which is really fantastic. And there's such a range of offers for our residents around physical activity. And that isn't just kind of the classic sport where some people might not feel they're in that position, but it's encouraging walking groups through libraries, that sort of thing. Work and health, we're starting this area of work and we'll be focusing on developing a workplace health toolkit and thinking about our health for employees in Thurrock. And we work in partnership with colleagues in our place and housing departments around housing and public health and thinking about well-being of residents. So yeah, lots of activity there, but we will finish there, conscious of time, so I'll hand back to Ruby and I'll stop sharing.
Thanks, Beth. Thanks, Harpal. That really was a speedy whiz through public health, and both our team are more than happy to give details, or if any of that interested you, or you have any particular questions. But we're mindful of time for the half an hour. I think we've welcome any kind of comments and reflections now, if anyone wants to share any. And hi, Councillor String. Oh, just see Councillor Stringer's hand go up first, I think. So
yeah, just a couple of things. Can I just understand what national child measurement is? Is that sort of a thing, weight measurement and height and all that sort of stuff?
Harpal, do you want to talk
so I
a
can
little
come in
bit
there.
to that?
Yeah, so that's a really robust program actually. So yeah, it's when every child their weight and height is measured, and that's what leads to having our data set in terms of childhood obesity. So it is in different data sets you have different issues, but in terms of that data set, it is close to 100% complete. So that's where that data comes from.
Just one other thing. Toothbrushing. Are we really having to teach people how to brush their teeth? Surely that's a parental thing, isn't it? I mean, I was taught to brush my teeth when I was about 4 years old, I think. I can't believe we're having to do that.
I'll just come back on that point. So I think this is if you're working in the health setting, it's not so much of a surprise, but I think always when I've spoken to other counsellors and also to colleagues, it can come as a surprise. But a lot of the oral health work is to support early years. So that's younger children, to help them train them to do toothbrushing. And we have colleagues in the team that support that work. They work with early years settings, so nurseries, family hubs. One of the biggest, if not the biggest contributors to hospital admissions for under fives is due to poor oral health. And there's a huge demand on health services and a huge cost to that as well. And of course, it's not pleasant to take your, very young children into hospital for tooth extractions, and it always is a bit of a surprise. But I think there's more in this space that we can, of course, share. But absolutely, it's an important area, to the point that we have a ring fence within our ring fence to focus on this particular area. But again, we don't do this on our own. We work with others. Yeah, Rob, go for it.
Can I just very quickly jump in as the non-health professional here? Councillor Stringer, is a question I've heard before and I understand it completely. Just as a non-health professional, I'll tell you, up to 20% of households in Thurrock with young families do not have a toothbrush because the parents are not particularly well educated or whatever. And so what they think is, well, that my kids' teeth are going to fall out anyway because they're going to get a second set of teeth. Is that kind of challenge that we're having to address, whereby they don't understand the wider impacts on oral health and teeth extractions and impacts? So your question is a really good one. It's one we've had a lot. When you see the evidence of actually how many families do not have a single toothbrush in the family, it is really quite staggering.
Thanks, Rob. But yeah, it does always kind of, I suppose, catch me by surprise. But I think it is it is a very important issue. So yeah, I'll just Councillor Benson. Oh no, sorry, Councillor Pester. Sorry about that.
Just with regards to how we access the ward profiles for the people within our wards.
Beth, do you want to?
I'll share a link actually in this chat now. Yeah, I'll do that now.
And Beth, maybe with the JSNA link as well, that would be helpful. But yeah, would definitely encourage everyone to have a look at the ward profiles, because some of those metrics that we're talking about, you can see for your ward and how it compares against, I think it's against the rest of Thurrock. And Beth, is it nationally or with the East of England, the comparators?
It's primarily East of England. No, sorry, it's Thurrock. We're looking at wards against the Thurrock
average.
Yeah.
Thanks, Beth. Councillor Benson.
Yeah, just want to say that I am looking forward to the slides and all the links on them. But what really surprised me that your statistics nationally said that 65% of people have long-term health, stroke mental health. 65% seems very high.
Yeah, I think the thing to kind of we can give you more data on that, but I think the thing to kind of reflect on is a lot of our health outcomes, a lot of our health is some of it is obviously your risks are genetic, but others are due to lifestyle factors as well. So and some of these lifestyle factors are those things that we wish to support residents on early, but your risk of having a heart attack, for example, or having high blood pressure will be directly impacted by, what you eat, how much activity you do, and lots of other lifestyle factors in that space. So that is a probably high level figure, but what we can do certainly is look at all of those other long-term conditions. Some of the ward profiles probably have got some of those in, Beth, haven't they? I think, like with the cardiovascular disease as well. So you can actually just see on a ward level.
Okay, thank you.
Councillor Lake.
Hi there, yeah, thank you. Is there a direct correlation between the children who don't brush their teeth, the obese children, children whose parents don't work. Is there a connection between all of these? So when we look at a group within our wards, they will all have similar outcomes going forward.
Yeah, I think this is you've kind of a really, really good question. There is a diagram which we haven't shared, but there is a diagram which is, I don't know, Beth, don't want to get it wrong. Is it the foresight diagram? But it's really complex for something around weight. It's really complex, the factors which contribute to it. There is a link. We heard from Rob about the number of families who probably don't appreciate the importance of oral health, but of course there is a link with the diet of a young child as well, and you know how much sugar they're having, how access to sweets and even fruit juice as well, all kind of contributes. But the question you're asking is really important, because quite often it is very complex, and there may well be families where it's not just about tackling one issue. It's actually opening a conversation about more widely other issues that might be going on. And I think that's the value of having our thorough healthy lifestyle service, which kind of provides an opportunity to talk about more than one risk factor, or more than one lifestyle factor that families or individuals may want to improve their health on. But some of it is absolutely related as well.
Sorry, just to come back. So there's nothing specifically that jumps out. So you can say that there is a 70% chance of someone being overweight if they've got poor oral health and their parents don't work. That you've not drawn them figures and correlated those.
I think that's a kind of, there probably is some information on that, but I think where we tend to look at some of this in a little bit more detail are those links on the right hand side, the joint strategic needs assessment, which will look at it. And in fact, going forwards, you can see that physical activity is one of them, but it is really complex. What we can say absolutely is that health outcomes are correlated with some of those indices of multiple deprivation. So where there's areas where there's more complex challenges, you tend to have poorer health outcomes. That's not true for everything, but for a lot of health outcomes that does play a part. And that's an important point, not only for us locally, but when we're engaging with our NHS health colleagues and providing them information as well.
Thank you very much.
So just any other thoughts or reflections, Councillor Irvine?
Yeah, it was just a quick one. I'm just with the statistics, and I don't want to labour this too much. Obviously, you go to a lot of granularity and a lot of detail and depth in terms of the level of information that you're providing us. Question I've got is really with respect to, does it almost flow in cohorts? Like you can actually see a particular age group go through the system, they drop out for one reason or another, yeah, and then it's suddenly you find spikes in marked improvement, or is it actually a more of a stable set of data that we're actually utilizing at the moment?
Yeah,
does that make sense?
Yeah, it does make sense. What we can share, maybe Beth can share it if you're really if people are interested, is we have a public health outcomes framework, and it's a online resource where you can look at lots of indicators, because this is really what we've selected is a very high level, but for each of these indicators, something that we would be interested in is something called trend. So this is answering your question about whether over a short or long period of time, we are actually changing things. So physical activity levels haven't really changed in Thurrock when we've looked at them for over a decade. So there's been inactivity, and that inactivity has been there. And these are really complex and hard outcomes to improve very quickly, which is why there's so much focus on taking a concerted system-wide effort, because having one service and one programme is only part of the jigsaw puzzle. With some of the public health outcomes, it can feel very simple, but actually taking a system-wide approach is the right way to go to try and make these changes. But we definitely do look at trend, because it will give us an idea whether things are improving or things are not improving as well as we'd want them to.
Thank you.
Councillor Stringer.
Can I just be the elephant in the room here? It just seems to me that we're paying an awful lot of money out here to provide services that are generally basic parenting skills. This is child neglect. If your kids aren't cleaning their teeth and you haven't bought a toothbrush, I bet you've got a 75-inch TV on your wall, or you're out smoking, or you're out drinking, or you're buying fast food, and you haven't bought your kid a toothbrush. We shouldn't be doing that. We shouldn't be funding that. The parents, that's parenting. My dad would have slapped me around the head if I hadn't cleaned my teeth. You know, I don't understand. I really, it's so worrying that as a nation, we're having to teach people to brush their teeth. I can't believe it. I understand it. And obesity, that's diet. That's feeding your kids the wrong stuff. You watch them in Aldi's, they go in Aldi's, they've got bags and bags of crisps, bottles and bottles of Diet Coke, 3-litre bottles of Diet Coke. The whole thing is, the whole parenting is just gone. We've just lost parenting, like, and it's upsetting and worrying. But I'm sorry, I just had to say that. I'm baffled by it, or I can't believe it. 20% of people haven't got a toothbrush. I've got a few here. I'll send them around. Anyway, sorry, I just
no.
I think program, the stringer program. Yeah.
I think quite often when we're sharing some of these statistics, people can be quite surprised by them. And as you've mentioned, a lot of people do feel quite passionate about why is this situation the way it is. I think there is lots there are lots of wider factors that influence decision making for families, and there's also looking at periods of time and different this cost of living pressures also at the moment, which is particularly high, impacting families. But some of this might be that over generations there may be changes in views, but there's also access to services as well, so access to dental services. So it's really complicated. We do have our two colleagues who kind of focus on just this, and a lot of the work is really, as I mentioned, looking at working with family hubs to support families and to raise awareness, and also with early year settings such as nurseries, and there is a lot being done around this area. But yeah, I can understand that. I think with lots of things, it can seem quite simple initially, but actually changing behaviours, it does take some energy, and it can often need some support from other places as well, which is why some of these services exist, and to support people through some of these challenges. I'm really mindful of time as well, and it's a very warm evening. I just want to say, I guess, unless there's any other kind of burning questions, a thank you to you all for coming, and this is being recorded, so please do share with colleagues, and I think Democratic Services will be sharing more widely as well. But more than happy to, if you have any particular areas you want to follow up on, just if you contact Democratic Services, they can, Dominic's on the call, you can field the questions and come back to us. I
Thank
hope
you very
that's
much.
okay.
Thank
Really
you.
good.
Have a good
Okay,
evening,
all
everyone.
right. Thanks very much, everyone.
Bye.
Good
Bye.
evening.
Bye.
Have a good
Bye-bye.
evening.